Hi, everybody. I'm back for another interview, and this is Peter Gordon from New York Financial Organizers. And today I'm here talking with Dr. Eric Turk, who's a trained chiropractor, but he does have a specialty in rehabilitation and physical therapy. And I view him as being a unique individual and who really helps people. And so, with that, hi, Eric. How are you doing today?
Hi, good morning, Peter. Nice to see you. Thanks for having me.
My pleasure. So, why don't we start with a little bit about your background?
Well, I think the first thing that I like to tell people is that, the most important thing about me is where I'm from, which is Brooklyn, something that, if you're from Brooklyn, especially when your parents are from Brooklyn, your grandparents are from Brooklyn,
I share
uh,
that.
that is something that you really want to make sure that defines you, regardless of your specialty in business. Um,
We're
I'm
talking
very
about
proud.
old time Brooklyn.
Old time Brooklyn, Sheepshead Bay, right? Coney Island Hospital. My grandmother was a registered nurse. My mom was a school teacher for the Board of Ed, working in special needs, special ed back then. So the caretaking gene and the making a difference gene runs through and through the Turk family. And I got it. And I've actually, since I was a teenager going to Midwood High School, I wanted to work in rehabilitation. It sounds kind of crazy, like who says rehabilitation? I didn't say rehab at the time. I loved going to the chiropractor. I loved going to the physical therapist. I didn't like going to the orthopedic doctor quite as much because it meant you broke something, but I did like the orthopedic doctor. She was wonderful. And I was actually kind of hoping at the time there would be a time and place when I went to school where I could mix all of those things up. And I was very fortunate. By the time I went to college, I went to University of Massachusetts, Amherst. I studied, at that time they called it exercise science. Now it's kinesiology. I studied the way the body moved, when it doesn't move properly, injuries, how to make it better. And I also studied psychology. I really enjoyed the mind body approach that you hear so much about. Unfortunately, when I finally went to chiropractic school in 1998, that chiropractic school was one of the first few that was starting to take on the integrative model of medicine, medical doctors and chiropractors and nurses and physical therapists. Consequently, although I don't do all of those things, my primary degree is as a chiropractor. I have certifications in physical therapy and massage therapy. And all I do now at this stage of my career is make house calls to people who had a major surgery, who had a stroke, who had cancer. I work with some of the major teaching hospitals, and I provide all those forms of therapy, therapeutic services, and 21 years of know-how at this time professionally, plus from my teenage years wanting to do this for a living. And I bring that to the home. I bring that to the person who just lost the ability to move their leg or just lost the ability to read or write or speak, and work on the in-home rehab experience, making it as as beneficial and therapeutic as it can be.
And that goes back to how we met. When we first met, I was beginning my business, and I really the way I began my business was the experience I had with my parents and my mom. Actually, we hired you to help my mom, and I saw you work in action, and it was really remarkable. My mom was uh, uh, bedridden and had no use of one hip, and you worked with her, and it was really a great experience to watch that. And could you tell us about how you do work with seniors?
Yeah, that's a well. First of all, what I've learned in practice, and probably people have said it before me, going into private practice and then now doing only house calls, is there's no bigger blessing than to be referred somebody's parents, grandparents, and their children. It's wonderful to get the person you know as your patient, but when somebody trusts you with the elders and their children, and that's how long I've been doing it, just goes to show that it's a good thing I started when I was a teenager. But one thing that I've learned, that when you're working inside of healthcare, especially, and we work in the geriatric field, but in healthcare and in the geriatric field, making sure that we take amazing care of the seniors, the people who, because of them, we're here. And it takes a personality, it takes a special hand. Some people, as you very well know, like when it comes to a restaurant, you like it spicy, you like it mild. Some people like it to be more aggressive. Some people like it to be a little bit more passive and relaxed. Some people you need to educate a little bit more. And I love that. I love spending time with people. When I ran two busy practices, one in Sheepshead Bay and one in Washington Heights, you're busy on to the next patient. Like the restaurant analogy, you're turning over the next table. If I see 3 or 4 patients in a day for an hour to 2 hours, educating, empowering the patient to take control of their health. Baby boomers especially want knowledge. They want passion. They also want people to spend time, and they want them to do it in a way that makes them feel good, like they're not a baby. They're still involved in their decision making, which you often see is a complaint with inside of the elder community, and rightfully so. People go, they're old, and they don't give them the time of day. They're the decision maker. And to be able to find that fine balance between what's right for them and keeping them in power, but also, sometimes they'll tell you, don't be so easy on me. I'm
Right.
86 years old. Just because I had a stroke, I can take it. Being able to spend time with people is the only way that you can get there. And slowing down my book of business to just a few patients a day and spending more time versus less of them is how I'm able to really make a difference inside of a world where people are suffering from one surgery to the next, or maybe they had a bad outcome and they don't think they're ever going to get better. That's where I like to try to make a difference.
Yeah, and one thing I know about you is that how you get business is unique. Why don't you talk a little bit about that?
Well, if it wasn't for financial organizers like yourself who are actively involved in the well-being and financial health, because they trust you and you're involved in the other thing that's most important, including your health, which is your wealth, right? Your family. There were a few top 5 things, especially in the pandemic. Um, in addition to like-minded professionals such as yourself, the geriatric care manager, the social worker, the coordinator, often with somebody who is being released from the hospital. And those are the two, I would say, buckets that I'm often getting the referral from. The discharge team at Mount Sinai, Sloan Kettering, NYU Langone, the nurses and the social workers, the caregivers who are responsible for when you get out from a stroke or from a surgery, they want to make sure that you have everything you need. Thankfully, through the graces of, word of mouth and recommendations and doing a good job and hearing my mom and grandmother in my back of my head do a good job. This person belongs to somebody. They're somebody's mother, father, or sister or brother. Those hospitals thankfully call upon me. And then there's a lot of private professionals like yourself and the social workers and other physicians who they're in the home and they say, you know what, you need to get better. You need this type of service. And it's through those referral sources and those individuals that keep me busy and keep me involved in other people's recovery and well-being.
That's great. Um, and this is a question I'm not really. I don't ask most people, but I'm going to do it with you. And what makes you special? Because I know
Well,
you are.
I appreciate that. I already told you some of the more obvious ones, but some of the less obvious ones is that I I'm following a childhood passion and a dream to do this. And like anybody, you fall off that vision sometimes where is this too hard for me? You're damn right it's too hard, but that's why it's something that I love because taking taking on the responsibility of improving people's lives is a big deal and it should be handled as such. And I want to make sure that I restore a little bit of that faith in healthcare that I think has been lost. And, that's kind of me being maybe being an old soul, but having my mom and grandmother inside of helping children and helping people in the hospital and having that desire as a teenager playing sports. I mean, hey, listen, I thought I was going to be the team doctor for the Mets or the Knicks or the Rangers, my favorite teams. Consequently, helping the seniors in our life and other people's lives isn't a bad sport and game to play in either. It's actually a wonderful game because you're involved in the family dynamic. And I'd be hard pressed to find somebody that who's now 46, which is my age now, who started this journey at 15. And it sounds maybe hokey or cliche or even corny, but that's okay. But I love it and it feels brand new every day because every time I meet somebody new, there's new stories and there's new hope and possibility. And so long as you're alive and I can be a part of the potential for you to recover, I want to be able to do so. And to be called upon by so many wonderful people, including the hospitals, is a blessing.
That's great. One last thing is, we were talking earlier. I'm recovering from knee replacement surgeries, and we talked about prehab, and I thought that's a great way to end in your philosophy on prehabbing.
Yeah. Rehab is great, but it works even better when you prepare. And prehab is just a fancy word for if you have the luxury of preparing, right? You don't necessarily get to prepare for a stroke, but you might be able to prepare for that hip replacement that's been nagging you or your knees to be replaced, as in your case. And the time to learn what you need to do is not after you've had surgery when you're in pain. First of all, it's just hard to listen and comprehend learning new material. That's one avenue.
Yeah,
The
absolutely.
other thing is you'd like to be able to set the body up for the best possible outcome and recovery. And if you're overweight and your body fat percentage is high, it means your body produces a lot of pain and inflammation, and your muscle tissue may not be that robust or just not doing a good job, not to use a fancy word. And if you can just help the body to not start at square zero, or when you've had surgery, you're now at square negative something because now you're in pain. If you could get yourself along the lines of recovery as if you're having the surgery or you've had it already, so that now when your body has had it, it's already in the growth and repair and recovery phase. That's buying all your ingredients, prepping them the night before, washing and cleaning, and then when you make that big pot of sauce, you don't have to do everything all at once. We all know if you're doing something like that, that's a lot of work. And it then becomes not only not fun, but cumbersome, and quite possibly is going to lower your recovery, and it's going to make it longer and more arduous. So if you can lose the weight, right, it's easy to say get in shape
Oh,
and exercise and
yes.
diet, but even if you just start turning the corner a little bit, you lose 5 pounds and you're en route to the weight loss by maybe changing your diet a little bit. That prehabilitation concept to improve your outcome can be used in so many different ways. I would love to talk to anybody who wants to have a conversation about that.
So I'm going to have your name and information at the end of the video. But look, tell us the best way to get in touch with you.
I like being a resource for people. And one thing that the pandemic has taught me, or any time of crisis, is to be a resource. Email me, go onto my LinkedIn page, go onto my Facebook page. There's a lot of people who've said nice things. I didn't pay most of them, only a couple of them. But I'm really an open book. I volunteered for 10 years at Midwood High School as their team sports doctor. And I'm kind of going back to the things that built me up to the, in the same cultural way of giving. If you want to know more, I would love to talk to you, or at least I can turn you on to a colleague of mine who might be better suited than I am inside of orthopedics, pain management, neurology, doing this for 21 years. And my mom and grandmother, as you know, if they're loudmouths from Brooklyn, that where I got it from. There's probably somebody that I know who's done it better than me or longer than me. And isn't that the way the world is just, laid better by paying it forward and connecting you to the right person? And if I can't do it, I know enough when to say I can't, and I'm going to get you to the right person who can.
Well, thanks a lot, Dr. Turk. It was great talking to you. And
Peter, thank you so much. I really appreciate it.
you're very welcome. And I'll see everybody at my next video. Bye-bye.
Bye.